The traditional physical therapy model of treatment, which includes exercise, manual therapy, modalities, this is a very, very effective treatment approach for patients that are having nociceptive pain. You go to the gym, you lift weight, you feel something pop in your shoulder, and you go to have physical therapy, and they go through a series of exercises. They do stuff to mobilize the tissue and mobilize the joint, and typically within a few sessions, you feel better. That's nociceptive pain. It has a very predictable symptom pattern to it and responds really well to traditional physical therapy approaches. That second type of pain, which is your peripheral neuropathic pain, sometimes responds well to PT, but oftentimes would benefit from physical therapy combined with other approaches. Sometimes the right medication from your physician, potentially more aggressive treatment approaches to really calm the nerves down in conjunction, so at the same time as doing physical therapy. This third type of pain, this nociplastic pain, is one that doesn't respond as well to those traditional approaches that we see with this more nociceptive or tissue-based pain. And so you might find that you go to physical therapy, you feel better for a while, then you have a flare-up. You go back into PT, maybe you feel a little bit better the second go around, but it's not as good as the first. You wait a little while, you go find another physical therapist, or maybe you go see an acupuncturist, chiropractor, a different physician. You start round robining through many providers. These providers are all fantastic. What may be happening is they may not have diagnosed you correctly, and they may have said, this is a tissue-based problem, so we're going to go ahead and treat this with a tissue-based approach. At the end of the day, the correct diagnosis is incredibly important for you to have the results that you are looking for when you are treating musculoskeletal pain. Something to note is that you often are experiencing more than one of these at any one time. So you can be having tissue-based pain at the same time as having nociplastic pain. The key for your provider is to be able to definitively figure out what's the thing that's really bothering you the most right now and keeping you from progressing. Oftentimes, if patients are having nociplastic pain, we need to address that pain first and do a whole bunch of other types of treatment that might include education, sensory integration, graded motor imagery, before the patient will be able to tolerate the more tissue-based approaches of manual therapy and exercise.